Access to national medical stores is only for the vaccinated. This week, NMS took a bold stand. The directive, which takes effect on 18th October, affects over 350 staff and members of the public. Today at Kololo Independence Grounds, the discussion of the right to vaccination was hovering.
An individual, I can choose that if you are a smoker, don't come to my house because there's a health risk. That's an enforcement. Where government may not chase away people, I can enforce in my house.
It's important that this, more or less, is a mandatory duty to every citizen to get vaccinated. We are actually trying to protect the right to life.
Everybody has a right to protect themselves. If somebody says, for me, I'll only interact with the people who are vaccinated or people who have negative COVID tests, you can't stop them. It is a private right.
The exercise upholds the directive aimed at hitting the minimum 4.8 million vaccinated Ugandans before the country fully reopens.
People should be vaccinated because now we know countries which have vaccinated more people, they are opening their societies. They are now opening schools.
That will help us to make sure that we have everybody coming back. People who had stopped working, people had stopped working, they will come back to work, and that will help us to get the economy back on its feet.
Schools are set to resume next month with institutions of learning before other institutions at the start of 2022. In view of government, the exercise fulfills the ambition to vaccinate particular population of students before reopening.
But by 1st of November, we are going to have a special program to vaccinate in all those institutions, students who are in the institutions themselves. So if you are vaccinated, you produce evidence. If you are not vaccinated, you will be vaccinated in the school setting.
Ministry of Health figures indicate 60% of the targeted 4.8 million Ugandans have been vaccinated with the first dose. The ministry hopes the numbers will rise with the increased access to vaccines.
Now, unlike what was in the previous months from March, as we speak now, we are past the stage where vaccines are the main limiting factor.
The jabbed individuals view the exercise as a preventive measure.
Normally, for you to travel without any challenges, they require you to have a card showing that you have been vaccinated. So I'm preparing for that journey.
I wanted to prevent myself from the virus, from COVID.
Ministry of Health has on several occasions encouraged different stakeholders to rally the public to go for vaccination. The exercise here was meant to reach out to 25,000 Ugandans. Ramson Muyure, CTV PM edition.